Right. Welcome back. Today we are going to discuss about nursing diagnosis and care plan for anemia. Hope you all know that what is anemia. It is a condition characterized by low amount of hemoglobin than the normal level, that reflecting a decrease in the number or function of red blood cells within the circulation. As a result, the amount of oxygen delivered to the body tissue is also lessened. So, less amount of hemoglobin and less amount of red blood cell and less amount of oxygen or no oxygen delivered to body tissue, and this oxygen is essential for the normal functioning of the body. Anemia is caused by blood loss, decreased red blood cell count or production, or the destruction of red blood cells. There are many types of anemia. While some anemias are mild and temporary, others can be chronic and lifelong. Anemia can develop from poor diet, a genetic condition, cancer, autoimmune diseases, toxic chemicals, and infection. So it can develop from poor diet. Genetic condition means from generation to generation, from cancer, from autoimmune diseases, from toxic chemical, and also from infections. Now we will see the symptoms of anemia. Fatigue, general weakness are the general symptoms of anemia. Apart from that, lightheadedness, headache, that is from central nervous system. Then pounding or whoosing sound in the ear, tinnitus, pounding or whoosing sound in the ear. Dyspnea, breathing difficulty, tachypnea or increased pulse rate, fast or irregular heartbeat, palpitations, chest discomfort, chest pain, pale skin, cool skin, reports of feeling cold, numbness in the hands and feet, and brittle nails. See, these are all the common symptoms of anemia. Now we will see the types of anemia. Types of anemia caused by nutritional deficiency, which include iron deficiency anemia, and that is the most common type of anemia. If someone is asking about anemia, one thing will always come to your mind, that is iron deficiency anemia, and that is a common type of anemia. Then pernicious anemia, then megaloblastic anemia. These are all the anemia which is caused by nutritional deficiency. Then type of anemia caused by genetics. Sickle cell anemia, thalassemia anemia, Fanconi anemia, Diamond-Blackfan anemia. Then types of anemia caused by abnormal red blood cell function, production and destruction. Hemolytic anemia, Aplastic anemia, Macrocytic anemia, Microcytic anemia, and Normocytic anemia. Okay, these are all the different types of anemia. In another video, we will discuss all these anemias in detail. Now we will see the nursing diagnosis. First nursing diagnosis based on the priority is inadequate oxygenation, because there is less hemoglobin production and there is less RBC. So the nursing diagnosis you can write like this: ineffective tissue perfusion related to decreased hemoglobin level as evidenced by pallor, shortness of breath, and low oxygen saturation. Ineffective tissue perfusion related to decreased hemoglobin level as evidenced by pallor, shortness of breath, and low oxygen saturation. And what is our goal? The patient will improve tissue oxygenation or improve tissue oxygenation. And what is the planning? Monitor oxygen saturation level regularly. Administer supplemental oxygen as prescribed. Encourage rest periods to reduce oxygen demand. Educate the patient on recognizing the signs of inadequate oxygenation such as shortness of breath and fatigue. Collaborate with physician for potential adjustment in treatment to improve hemoglobin level, and administer the medication as per the doctor's order. And apart from that, always you have to do proper history collection and physical examination. So these are all the planning you can do for ineffective tissue perfusion or inadequate oxygen. And if you're writing in columns, you have to write assessment, diagnosis, planning, rational, implementation, and evaluation. And in the first column, that is assessment column, you have to write subjective data and objective data. Subjective data include what patient says about their condition. Objective data include what you have observed from the patient situation. In the nursing diagnosis column, you can write ineffective tissue perfusion related to decreased hemoglobin level as evidenced by pallor, shortness of breath, and low oxygen saturation. Also, in the same column, you have to write goal. In future tense, you can write the patient will improve oxygen saturation or oxygenation. Then in the planning column, you can write all this planning and start with history collection and physical examination and end with administer the medication as per the doctor's order. The next column, you can write the rationale. Why we want to monitor the oxygen saturation, to understand the level of oxygen or to maintain the oxygen saturation. Okay. Then you can write implementation, and at last you can write evaluation. In evaluation, you can write the patient improved the tissue oxygenation or the patient's condition changed. All right. So this is the first nursing diagnosis you can do or you can write for anemia. Second one, fatigue and activity tolerance. The nursing diagnosis is activity intolerance related to decreased oxygen carrying capacity of the blood as evidenced by patient reports of fatigue and decreased activity tolerance. So there is no oxygen supplied to the part of the body. So automatically what will happen to your body? The body will get tired. So you can write like this: activity intolerance related to decreased oxygen carrying capacity of blood as evidenced by patient reports of fatigue and decreased activity tolerance. Then goal, the patient will increase activity tolerance and reduce fatigue. While coming to the intervention or planning, first one, assess the patient's level of fatigue and activity tolerance. Second one, encourage the patient to engage in activities like light activities and gradually increase as tolerated. Then schedule activities to allow for rest period also. Then educate the patient about the importance of balanced activity and rest. Then provide emotional support to help the patient to cope up with the limitations. Next nursing diagnosis is nutritional deficiency. So the diagnosis is imbalanced nutrition, less than body requirement related to inadequate intake of iron-rich food as evidenced by low hemoglobin and iron level. Imbalanced nutrition, less than body requirement related to inadequate intake of iron-rich food as evidenced by low hemoglobin and iron level or as evidenced by fatigue. Goal, improve nutritional intake to support hemoglobin production. Interventions or planning include assess the patient's dietary habit and nutritional intake, collaborate with dietitian to develop a good meal plan rich in iron, vitamin B12 and folic acid. Educate the patient on food high in iron and other nutrients and importance for blood health. Monitor weight and lab values to assess the nutritional status, especially iron value and hemoglobin value. In all the nursing care plan, you have to write health education because health education is more important than giving some medication here, because the patient should take some initiative to change his or her lifestyle to change or to increase the level of hemoglobin or red blood cells or iron level. Next, medication management. So for that, you can write ineffective health management related to lack of knowledge about medication regimen for anemia as evidenced by improper medication use. Goal, ensure effective management of medication regimen. Interventions include educate the patient about the purpose, dosage, and potential side effect of the medication. I mean the prescribed medication. For example, iron supplements, folic acid, vitamin D. So which we cannot take iron tablets or folic acid tablets or vitamin B12 tablet. We have to go for proper diagnostic procedures like blood test. We have to check the RBC count and we have to undergo all the tests. After that, as per the doctor's orders, we can take the medication. If we are not taking the medication without prescription, that can lead to complication. Even the correct dosage we have to take. Then develop a medication schedule that aligns with the patient's daily routine and encourage the patient to keep a medication log. Then assess for compliance and understanding during follow-up visit. Follow-up visit also very important in this nursing diagnosis. Next one, blood transfusion management. In some severe situation, we have to go for blood transfusion. because if there is no blood at all, means through medication or through iron tablets or through folic acid tablets or through diet we cannot come back to the normal level. In that case we have to go for blood transfusion. That means we have to induce blood into the body. Okay, so the nursing diagnosis is risk for transfusion reaction related to administration of blood products. Goal: ensure safe administration of blood transfusion. Intervention: verify blood type and cross match before transfusion. Monitor the patient closely for any signs of transfusion reactions. Educate the patient about the procedure and what symptoms to report immediately. Document the transfusion process thoroughly, including vital signs before, during, and after the procedure. And this nursing diagnosis is also very, very important, especially if the patient is going for blood transfusion. Otherwise, no need of adding this nursing diagnosis. Then education and self-care, that is a common one, you can add it. Deficit knowledge related to or knowledge deficit related to anemia management as evidenced by questions about the disease and treatment plan. Goal: enhance the patient's understanding and ability to manage anemia. Planning: provide comprehensive education about anemia, teach the patient about self-care technique, encourage adherence to follow-up appointments, offer written materials and resources for additional information. Alright guys, so these are all the nursing diagnosis and care plan you can use for anemia. Blood transfusion you can write if they are going for blood transfusion. Otherwise, no need of adding. Okay, hope you understand. Next time we will come with other nursing diagnosis and care plan. Thank you guys. Bye.